UITM, Kota Kinabalu, Sabah. In May 2024, the students faced an outbreak of a disease that could lead to death and the name of the virus, measles virus.
Measles is a highly contagious viral disease caused by the measles virus, a member of the genus Morbillivirus within the family of Paramyxoviridae. This virus is an enveloped single-stranded RNA virus, and despite the existence of multiple genotypes, there is only one serotype, which means immunity from one strain generally provides immunity against all others. The measles virus spreads through respiratory droplets. When an infected person coughs or sneezes, it can remain viable in the air or on any surface for up to 2 hours, making it exceptionally contagious. Approximately 90% of non-immune individuals who are exposed to the virus will contract the disease. Once inside the body, the virus initially affects the respiratory tract before spreading to other parts of the body, including the skin, eyes, and the immune systems. Symptoms of measles typically appear 10 to 12 days after exposure and begin with high fever, runny nose, coughing, and red eyes, also known as conjunctivitis. This is followed by distinctive red rash that usually starts on the face and neck before spreading to the rest of the body. Complications from measles can be severe, particularly in young children and individuals with compromised immune system, and include pneumonia, encephalitis, which is brain swelling, and even cause death.
Almost every country in the world has experienced an outbreak of a dangerous disease, and we should know how another developed country overcomes the problem of measles transmission. One of those countries is the United States of America.
In 1912, measles became a nationally notifiable disease in the United States, requiring U.S. healthcare providers and laboratories to report all diagnosed cases. In the first decade of reporting, an average of 6,000 measles-related deaths were reported each year. A vaccine became available in 1963. In the decade before, nearly all children got measles by the time they were 15 years old. It is estimated 3 to 4 million people in the United States were infected each year. Among reported measles cases each year, as estimated, 400 to 500 people died, 48,000 were hospitalized, 1,000 suffered encephalitis, which is swelling of the brain. In 1978, CDC set a goal to eliminate measles from the United States by 1982. Although this goal was not met, widespread use of measles vaccine drastically reduced the disease rate. By 1981, the number of reported measles cases was 18% less compared with the previous year. However, a 1989 measles outbreaks among vaccinated school-aged children prompted the Advisory Committee on Immunization Practices (ACIP), the American Academy of Pediatrics (AAP), and the American Academy of Family Physicians (AAFP) to recommend a second dose of MMR vaccine for all children. Following widespread implementation of the recommendation and improvement in first dose MMR vaccine coverage, reported measles cases declined even more. Measles was declared from the United States in 2000. This means the absence of the continuous spread of disease was greater than 12 months. This was thanks to highly effective vaccination program in the United States, as well as better measles control in the Americas region.
We can see that vaccination is the best solution to overcome this dangerous epidemic. But is there a special treatment for measles patients?
There is no specific treatment for measles. Caregiving should focus on relieving symptoms, making the person comfortable, and preventing complications. Drinking enough water and treatment for dehydration can replace fluids lost to diarrhea and vomiting. Eating a healthy diet is also important. Doctor may use antibiotic to treat pneumonia and ear and eye infections. All children or adults with measles should receive 2 doses of vitamin A supplements given 24 hours apart. This restores low vitamin A levels that occur even in well-nourished children. It can help prevent eye damage and blindness. Vitamin A supplements may also reduce the number of measles deaths. Community-wide vaccination is the most effective way to prevent measles.
In 1971, Dr. Maurice Hillman has created a vaccine that is very effective in overcoming the transmission of measles and the name of the vaccine, MMR vaccine.
MMR vaccines will protect against 3 diseases, which is measles, mumps, and rubella. CDC recommends that children need to take 2 doses of MMR vaccines. Starting with the first doses, children in 12 months to 15 months need to take it. But for the second doses, children need to take it around 4 to 6 years of ages. Other than children, teens and adults recommended to be up to date on their MMR vaccinations. MMR vaccines is very effective and safe. This is because 1 dose of MMR vaccines consists of 93% of effective in preventing the measles disease, while 2 doses of MMR vaccines consist of 97% of effective in preventing the measles disease.
Some people do not believe in the effectiveness of vaccines on human health. We must look for proof that this measles vaccine is safe to use, and the proof in the data analysis.
Before the introduction of the measles vaccine in 1963 and the widespread vaccination, major epidemics occurred approximately every 2 or 3 years and caused an estimate 2.6 million deaths each year. An estimate 136,000 people died from the measles in 2022, mostly children under the age of 5 years, despite the availability of safe and cost-effective vaccine. Accelerate the immunization activities by countries, WHO, the Measles and Rubella Partnership, and other international partners, successful in prevent an estimate 57 million deaths between 2000 until 2022. Vaccination decreased an estimate measles death from 761,000 in 2000 century to 136,000 in 2022 century.
With the passage of time, many improvements have taken place, including the measles vaccine and the name of the new vaccine, MMRV vaccine.
Other than MMR vaccines, there are other alternatives that can be used, which is known as MMRV vaccines. MMRV vaccines is only licensed that can be used in children who are 12 months of ages to 12 years of ages. MMR vaccines works to protect against 4 diseases, which is measles, mumps, rubella, and varicella, which is known as chickenpox.